Medical notes this week. Glucosamine is a popular dietary supplement for people with osteoarthritis and joint pain, but a study in the British Medical Journal shows that it could also help lower the risk of heart disease and stroke. Researchers say that people who use glucosamine supplements have a 15% lower risk of cardiovascular events, but they say further studies are needed to try to figure out why. The Centers for Disease Control and Prevention has issued statistics on two major issues. First, HIV. The CDC recommends that people aged 13 to 64 get tested for HIV at least once in their lifetime, but new statistics show that fewer than 40% do so, and only about 30% of people most at risk of HIV were tested last year. Meanwhile, experts are starting to think about next flu season, and the CDC has concluded that last year's flu vaccine was only 29% effective. The agency says the vaccine was much more effective early in the year until a new strain arrived in February that the vaccine didn't predict. Experts estimate about 60,000 Americans may have died from the flu last year. And finally, midday naps aren't only for toddlers. A study published in the journal Sleep finds that among 10 to 12-year-olds, a 30 to 60-minute daily nap is connected to a higher IQ. Researchers say without naps, drowsiness affects up to 20% of all children, leading to negative cognitive, emotional, and physical effects. To combat this, researchers suggest implementing midday naps into kids' schedules. And that's Medical Notes this week.